It's 8 in the evening and all the clinics are closed. So I'm going to message a clinic which runs on AUMY and try to book an appointment. So let me ask it if it can book an appointment for me tomorrow as my tooth is hurting badly. Right. Okay, it replies back with the four available slots. So I'm asking it if I can get an appointment during my lunch break. And as you see in the calendar, the slot for 2 to 4 p.m. is already blocked. So let's see what it says. So here is what has happened. Omi actually checked the clinic's calendar, checked that the slot is blocked and not available for the booking, and it correctly answered the patient saying that that slot is not available. So let me now check if 4 p.m. is available. And it gives me four options with four doctors, and I'm going to go with the first one, Dr. Ananya Iyer. All right, and as you can see in the appointments here, there is no appointment. So let's wait for Omi to reply back, and here you go. It books the appointment for me. But notice what it does. It has not just booked the appointment, but it has also asked me to follow the clinic on Instagram. Now let me try to stress test it and ask it about some medical decisions, and let's see if it advises me about it. So I've asked Omi if I can take a painkiller meanwhile, and let's see what it has to say. So it correctly points me to the doctor and take doctor's opinion on the painkiller and does not give any medical advice, which is as expected. So let me show you what happens after the chat. So OMI is not just going to chat with the patient, but it's also going to do the work after that. It actually goes ahead and books the appointment in the platform. As you can see here that it has booked me for 4 p.m. with Dr. Ananya Iyer. Reason for booking was tooth pain. And not only this, but the operator in their operator inbox can also see the conversation, can take over the conversation from the AI. So a human is always in loop and in control. See what has just happened. One evening, one patient who'd otherwise have messaged the clinic down the road and a new follower on the way. I'm not going to put a number on your screen and pretend I know your practice. You know what a new patient is worth to you. So ask yourself how many of those you're losing every week after 6 o'clock. It answers, it books, it knows when to stop, and it never goes home. I'm Jayesh. I'll do one of these every week. Next will be the patient who is due for a recall, maybe a maintenance, a cleaning session, or a scaling session. And we'll see how OMI chats with the patient and books it. Thank you.